Good morning, everyone. I'm going to just get started with our brief introduction, give some time for more individuals to join us for today's webinar. As you can see, we have our title slide up for everyone. We are so excited to have you here today. So on behalf of the Health Coalition of Passaic County, I would like to thank you all for taking the time to join us today for this virtual Health Equity Roundtable entitled Best Practices in Care Coordination, Piloting a Value-Based Approach to Advance Maternal Health Equity. We would first like to also thank Quest for Health Equity, who through a grant to the Health Coalition of Passaic County is funding our HCPC Pathways to Success for Women's program that you will hear about today. For those of you who may be less familiar with the work of the Health Coalition of Passaic County, we are a 501c3 nonprofit organization located in Paterson, New Jersey. Our mission is to advance health equity and address the social determinants of health through a dedicated coalition. We're one of the 4 New Jersey Regional Health Hub organizations recently highlighted in the White House Social Determinant of Health Playbook. And as a regional health hub, our work falls under 4 main pillars, which are data integration and analytics, community unification, working in strategic partnership with the state of New Jersey, and developing and launching innovative programming, which is where our discussion is going to center around today. And I'm going to just stop sharing my screen so that we can see one another a little bit better. There we go. Thank you again for joining us. And as everyone should be aware, there is an unacceptable disparity in maternal and infant health outcomes in New Jersey and also across the nation. But the good news is that there's a lot of organizations working to find solutions, to change systems, and to implement programs to advance health equity and address health disparities. So today we're going to hear from some local as well as national champions of work that's being done to address these issues, and particularly to connect women with the support they need so that they can enjoy happier, healthier lives. Our panelists for today's discussion are Dr. Sarah Redding. She's the founder of the Pathways Community Hub Institute and co-developer of the Pathways Community Hub model. Fiorella Vera, the Social Determinants of Health Manager of all programming at the Health Coalition of Passaic County. Carolyn McCombs, Executive Director for New Destiny Family Success Center. And last but certainly not least, Kendall Smith. She is the community health worker and also a doula with New Destiny Family Success Center. So thank you all for joining us today. Really appreciate your time and your participation. So to really kick us off and get started, I'd like to start by talking about the key drivers of maternal health disparities. And I'm going to kick this over to the full panel. So anyone who would like to get us started, from the perspective where you are, what is a contributing factor to the disparities that we're seeing and what's making them worse? So anyone who'd like to start us off.
I'd like to start.
Thanks.
Thank you for inviting us to this conversation. It is core to the work we do at New Destiny Family Success Center to support healthy family outcomes and adult and child development. And I believe that the disparities we're seeing are very much related to issues of access, which are linked to issues related to poverty, and really just having a history of not trusting the health system in our communities. And I believe when you put all those factors together, coupled with difficulty in relationships with family and extended family members and partners, it's kind of like a layering of issues that really do negatively impact health outcomes.
Thanks so much. Who else would like to, from your perspective? I mean, so important, Carolyn, exactly what you're saying, and we really appreciate your perspective as a community-based partner organization in the heart of Paterson, working with folks on a regular basis. So thank you. Fiorella?
Yep, I agree with Carolyn 100%. I think lack of access to care. What we are seeing here in Passaic County through our work with the Pathways program is, even though we have a lack of access to care, it's because health coverage is lacking for a lot of our members that are enrolled in our program. So they're dealing with a lot of social factors and as well as lack of access to quality health care. So that's a way that, it's being really confounded. Their maternal health outcomes are poor because they're not receiving early care early on, and preventative care for any chronic conditions. And I think all of that also in Passaic County, we deal with folks from racial and ethnic minority groups that don't have the fair opportunities to economic, physical, and emotional health overall.
Thank
So if
you.
I
Jump
could-
in, Sarah. Yeah, please.
Yeah, so if I could jump in, absolutely agree with everything that's been said. And I'm couching this, I'm a physician, so I'm hoping, I'm saying this with that in mind, but all of our funding goes to healthcare, right? And we don't put as much funding into community and community care. So there's a really big discrepancy in how we're actually funding the work that's happening right now.
Thank you so much. So, it's always interesting when you start a conversation about, like, these are all these factors, right? We know there's an issue. I think probably everyone joining us today realizes that these are things that we need to fix. And how do we do that? And I think, we're here to talk today about that value-based approach that could be a promising solution to this work. So, Fiorella, I'd like to start with you. What does it mean when we say a value-based approach to this work to address the issues that everyone just raised?
So I think traditionally our healthcare system and our system overall really used to work on a fee for service, which is all about quantity, how often you were seeing the doctor, how often you were doing a certain intervention. But the value-based approach really focuses on quality and outcomes. So we want to know what people are getting out of the care they're receiving. And it's not only clinical care, really social care as well. So that would be kind of models such as the PCHI model really focus on whole person care. We're focused on preventative care, how we can get the member the best quality of life and making sure they're addressing all of their social care needs as well as clinical care needs. So quality over quantity really for this approach.
Thank you. And I think that really is the core of the model development. Sarah, can you just elaborate on that a little bit more from your perspective as a physician and also as the founder of the model? How do you see value-based in regard to health-related social needs?
It was really something we learned along the way. So, started working with community health worker back in the late 80s, so at that point, that was way before social determinants of health or non-medical drivers of health. And when we started out, we just kind of started out the same way everyone else did, hired community health workers, put them out in the field and hope that that's going to change everything. And it didn't. When we looked at our data, it didn't get better. And so that was kind of the first development phase of the model, is listening to the community health workers telling us we do have to treat people like whole people and that all of their risk factors are important, whether they have safe, stable housing or access to a medical home. So we developed pathways as the first part of the model, and that was really just to look at any risk factor we could change, right? If it's something that we could actually make an impact on, it became a pathway, and a pathway ended in something that was meaningful and measurable to the person. So it's not so much the system, but the person in front of you, they need safe, stable housing. So we're not done with that pathway until they're in safe, stable housing. So it was a whole different way of looking at how to address things and to add that level of accountability, that it's not okay just to screen that there's a problem, but we have to do our best at least to try to fix the problems too. So that kind of then in a many year evolution became kind of the value-based payment, because we started to add payment for pathways and actually doing something that's meaningful.
Excellent. So I think, Fiorella, what I heard you talking about was from a clinical perspective, the system has changed to value-based approach, right? So paying based on the outcome, not the procedure. And it sounds like, Dr. Redding, what you're saying is that that's a similar perspective here in paying for the closing of those pathways in a meaningful way. I'm sure there's a lot more to unpack in that as we move forward, but anything to elaborate? from
I
either
just
of you?
I just wanted to add on, I think it's really important what Dr. Redding said about the needs of the member. So members have certain needs that they identify that we in the clinical space may not find as valuable because we're focusing on really treating their chronic conditions, treating that condition that they're dealing with at the moment. But as a result of all those social interventions, you're really driving towards reducing cost of care overall because you're improving their health outcomes, you're reducing the need for addressing those chronic conditions because you're working on preventative care. So I think that's also the basis for a value-based approach is through this approach, we're actually reducing cost of care, we're having better health outcomes for people because we are addressing the whole person.
Thank you. Carolyn and Kendall, don't be shy. I see you guys nodding. So if there's anything you
Yeah.
want to jump in here, feel free.
Well, I wanted to add that through working with the Pathways to Success, that I'm finding that a lot of the participants, they need to have the educational part, because if they don't know that they need to have a GYN doctor before they decide they need one, we become sexually active, let's put it that way, that they should have a GYN doctor. But what's happening, a lot of women aren't going to the doctor until they become pregnant. And so when they become pregnant, they don't know that they have other health issues. So a lot of that can be combated when we have, like, say, access to medical homes beforehand. So I believe that a lot of women just need the education to know that it's important to have a doctor in place. And what we're also finding out is that women, that once they become pregnant, they should also have cardiologists on hand. So.
Thank you so much.
I, from a perspective of someone who's worked in a prevention model for the past 18 years, this is all about prevention. And when we arm people with information, it empowers them to kind of navigate the issues of life much more effectively. So I really feel this approach is holistic, but it's highly relational. And that's critical because there's got to be someone that's coming alongside people to say, I recognize all the aspects of what's impacting your quality of life. We're here to see how we can partner with you to begin to address those issues. And guaranteed, the chronic health issue is going to have a much more positive outcome because we're addressing proactively those other issues that are also causing the stress and also causing the lack of access. If you need transportation to get to the doctor, how about we start to partner with you around how do you get your license? How do you get access to a vehicle? How do you access services that will help you get where you need to go? So there's so much more involved than just addressing that chronic health issue.
Absolutely. Okay, so for the folks who are joining us, so really this was like kind of setting the stage, right? Our opening dialogue, that we understand that there are issues and there are different ways that folks are approaching this, and we realize that a value-based approach to this work is really, really critically important. So I want to get into a little bit more of the meat about the actual Pathways Community Hub model and how we are utilizing that here in our community in partnership for the Pathways to Success for Women program. So I'm going to go back to you, Dr. Redding, and put you on the spot. If you can really just sort of, briefly describe, we touched on it a little bit, but the Pathways model, the core principles of that, and then we'll go from there.
Sure. So I'll try not to use my hands too much.
It's okay. I use mine all the
These
time.
are diagrams when I talk about this, but really when you think about it, the Pathways Community Hub puts structure into the community, right? Nothing changes except you're putting a Pathways Community Hub in place. And by having that really transparent, neutral entity that can contract with all of the existing community-based organizations that are already doing great work, may already have community health workers on staff or willing to bring them on. But by creating that network and then doing a standard way of collecting data, reporting data, using these 21 standard pathways to really track resolution of risk and bringing in that value-based payment, you build this whole infrastructure that wasn't there before. And so if you're a health plan or a funder coming in wanting to contract it's a lot easier to do one contract with the Pathways Community Hub that has this whole network that can give you data in a standardized way than coming in and contracting with each individual community-based organization. So it just puts some structure where there's kind of, every community we've worked in is kind of chaotic and different, but it's amazing once you lay the kind of just a standard structure in place, how things start to click. And what we often see, we're in, I think, 18 states now. So we've done work in all different kinds of communities. But once you have the structure in place and people really start to understand how the model works, then you start to see the outcomes, right? You start to see people really driving towards getting those pathways closed, which are going to bring you to the outcomes. So on a very high level, that's the model. So the key components of the model, we have standard data collection forms. We have 21 standard pathways to track risk to resolution. We have learning modules that Kendall was talking about how important education is. A lot of behavior change comes about with education. So we have standardized up-to-date learning modules for community health workers to use. We require a quality benchmark report. So at the national organization, we're actually tracking on a quarterly basis the performance of Pathways Community Hubs and looking for areas where they're really doing well, or maybe they need a little bit of help. And then our value-based contracting, which we call outcome-based contracting, but really the same thing. So those are the main components of the model. So.
Excellent. I'm going to keep you for a second. So you talked about outcomes in communities, so where this has been implemented. Are there some examples of outcomes that you would like to share with us for communities who've used this model?
Yeah, even in our pilot community was a county in Ohio, Richland County. We were able to show a reduction in low birth weight within our target population, but then over 4 years of implementing the Pathways Community Hub, we showed a countywide reduction in low birth weight. And we actually closed the disparity gap, which was really exciting to see, right? That, yeah, you could actually do something to start that persistent gap that's always there between, white and Black and other populations first. We could start to see that start to go away. And that's really, for us, that's the underlying reason why we developed the model, is to really get to health equity. In communities now, that the model really started with maternal and child health, but we're seeing communities use this model to address adults with chronic conditions, diabetes, hypertension, depression, other mental health, issues, substance use. We have, teams in schools that are working with families that are at risk. So I think that's the neat thing with the model is you can start with any population, but once you have the infrastructure built, you can expand, and to wherever the next need is. So we have a lot of, on our website, pchi-hub.org, there's a lot of our research studies are there, but also links to the Pathways Community Hubs to see their results, because most of them will put up an annual report every year too. So that's pretty exciting.
Well, thank you so much for that. Fiorella, I'm coming to you next, right? So we hear how this has worked in other communities and the structure. Can you talk a little bit about HCPC's experience in adopting the model, and then specifically about how we're using it here with Pathways for Women?
Yes, I think it's our journey as a Pathways adopter has really been interesting because HCPC started in 2017 with a target population, a pilot program of seniors, where we use the model, but in a more kind of customizable way for HCPC at the time. Really, we've transitioned and grown to full fidelity in the model. We currently have 3 programs that use the Pathways Community Hub model, and for 3 different target populations. So when Dr. Redding is talking about standardization and being able to move that model from different populations based on the needs of the community, that's something that HCPC is actually piloting right now. We are working with seniors, diabetes, and most importantly for our discussion today, it's women. So we focus on women in Patterson and Passaic City from childbearing age of 18 to 35. HCPC currently is contracted with 3 community-based organizations in Patterson and Passaic, one being New Destiny here represented by Carolyn and Kendall, And HCPC really works as the hub to have complete oversight of the program. We work with the community health workers at our CBOs to train them fully in the model so that they're fully prepared to go and enroll members at their sites. We are aware that, our partners are already doing this work. They already have access to the population that we're targeting, and they're integral to the fabric of the community. So we don't want to come in and kind of take over. We just give them the tools to be able to manage the pathways model with our support from our supervisor and from our manager to ensure that they are working collaboratively with other CBOs in our partner network to get resources for our members. So, and the reason that we focus on women from 18 to 35 is really because, as I think a lot of our panelists have talked about today, prevention is key for improving a woman's health overall. So maternal health, to have those really good outcomes, you need to be able to have access to care early on before you're pregnant and preparing your body for that journey of pregnancy and even postpartum. So we work with all types of women, pregnant and not pregnant, because we know that it's really all about women's health that will lead to those improved maternal health equity.
Thank you. So Carolyn, jump in. You're our
Sure.
CBO partner.
I'm trying to think of this quote. I'm not sure if I'm going to get it right. Something to the effect that if you educate a mother, you educate a family. And I don't think I've got it right. But the point of it is, if you can bring critical support to mothers, that impacts the whole health outcome for a family. And what I believe we've discovered in this process is that people are looking for answers to those issues that are affecting their health, their mental health, their economic health, their social health. And they don't really have many places to go. And what this model represents is an opportunity to come alongside a person while they're not in a crisis. They didn't just find out they were pregnant and now they're searching. No, that's not what this is. This is, we want to connect with you when you're not in a crisis and you recognize the need to be proactive in addressing all those social determinants of health. Now, they don't know that they're social determinants of health, but what they do know is I need to, get a job that is going to, meet all of my economic needs. I need access to childcare for my children. I need to restore a relationship with my children's father who's not paying child support. I mean, these are all things that come together to form a healthy outlook on life, but also puts that individual in the driver's seat, where they then now have tools that we can help them access to begin to have those better outcomes. So I'm sure Kendall will support this. We've been very, very, let's just say surprised. I will just say surprised that people are seeking this help out. So we don't advertise, but once you've impacted someone positively, they go tell a friend who tells a friend. And so now we have people coming to us saying, yeah, my friend told me to come. Here's my issues. And that's great. Like, if that's the win-win, that's now empowering the community.
Oh, that I can feel your energy and passion, and it's beautiful. And we're so honored to be a part of a very small part of this work. Kendall, can you come on, jump in here. Tell us, give us some of the experiences in talking with women, what their interest is in being a part of this, and maybe some of the outcomes that you've started to see.
Well, I wholeheartedly support what Carolyn is saying. It's a passionate type of environment. We support the women any way we can. But the one thing I like is that they come in for one thing, and then by the time they leave, they learn all about pathways, and they're excited about signing up for it. And not only are they excited about signing up for pathways, but they also tell their friends, like Carolyn said. But it's a family. If they feel like they're connecting to a family, and that you're their mother or their sister or their, grandmother, but you're telling them, like, look, you connect with Pathways. This is what we're going to do, and we're going to help you be the best version of yourself. But the one thing that we point out is that we're going to lead you in the direction that you need to go, but you have to do the work. And at the end of the day, it's all about your connection with us, but also connecting with yourself and being the best version of who you want to be. And we have mothers that come in that some of them are homeless, and we're finding that there's a big homeless crisis in the country, but it's a homeless crisis in Patterson, and they're young. So they're coming in at 18. The youngest I've had was 25 with 6 or 7 children, and they're homeless. So we're helping mothers feel good about themselves, even though they're dealing with the crisis. And so that's what I like about the Pathways program. And also I love the part about the learning modules, because we give them something to connect to inspire them, to empower them along the way. So, yeah.
I want to just add to what Kendall is saying, and that is that we celebrate their successes. And there's something contagious about celebrating success with someone, in the sense that, wow, wait a minute, I was able to accomplish that outcome. Now I'm ready for the next thing. And so before you know it, it's as if, they're now steering in a direction they didn't even see possible, until they were able to overcome one barrier, and then 2, and then 3. And before you know it, some of them are transforming their lives in a matter of months. And that's very rewarding for us to be a part of.
If I piggyback onto that, I also think it's really helpful for community health workers, because it's a really hard job and the burnout is very high for CHW. So as a supervisor, if you can sit down with a community health worker and say, I know you feel like you're not making progress, but let's look back 3 months at all the pathways you've closed, all the things that you've really accomplished to make a difference in this person's life. So we've seen that as a way to be able to help build more retention of CHW workforce too.
Thank you. Yeah, I was going to ask Kendall, from your perspective, and Carolyn too, and Fiorella, everybody, I guess. We know there's so many needs, and sometimes it's hard to know where to get started, right? And there's lots of different ways to approach this, but what value have you found in the model being able to help guide you? You said, you're able to look back and see that we've done these things, but Kendall or anybody, have you found value, and how have you utilized those tools in this work with women? Maybe that's a weird question.
No, I think I can, and Kendall, please feel free to add on, but I think the way that the documentation is standardized, it's really a step-by-step process. So the moment you open up a pathway, and pathways are just identified as a modifiable risk or a need of the member based on what they're communicating to you. So it's really a step-by-step process. Today, we identify the priorities you want to work on. And let's focus on 2 at a time. Really, we keep a member for at least 3 months. So that's 3 months of building that relationship, of kind of the family that Kendall mentioned, that constant support, of giving them the tools to sustain those changes after. So that step-by-step process, through the documentation, through the monitoring, and the consistent contact that you have with the member, being able to document all that, quantify it, is really important for you to see the outcomes that you created, and to see what the member has inputted into the program as well. So it's kind of just a really collaborative approach. And I think from our community health workers, from their experience, what they've expressed is that it's a way to keep track of everything they need to do in real time, and also a way to look back and say, well, hey, I got a lot of things done. Maybe the impact I'm feeling is small, but I've really made a difference in somebody's life.
Great. And I want to highlight, I think I heard Sarah, you say early on that structure has helped in other communities then be translated into improvements in advancing health equity and also in reduction of costs. Is that correct?
Yeah. And interesting, like, side development of the model, it wasn't really there when it was first designed, but it's the whole concept of a finished and complete pathway. It's a pathway you can't close, you can't get to the outcome, but what the community health worker does is tracks everything that they've tried And maybe the resource doesn't exist, or the resources just aren't acceptable to the population you're working with, or there's so many different reasons why you can't get to an outcome. But to be able to quantify that for an entire community, then you can start to go in and use that data to make policy change. And so it's really exciting to see, community health workers get really sad when they can't finish a pathway, but we're like, no, this is really good information that we can now take and do bigger system changes that we didn't have this data before. We just had anecdotes, and stories of what wasn't working, but now we have hard data. And so we've seen policy development based on pathways that don't close.
And thank you for sharing that, because I really believe that at the end of the day, it's all about policy, because there are some aspects of the infrastructure in which many of our community members live that can't change, whether it be how you qualify for Section 8, whether it be how do you qualify for Medicaid, many other issues. And so it's important that we have that data, because the day does come when we actually have an opportunity in our state now to talk to policymakers about the issue of housing in our community and what it looks like on the ground. How is this impacting childbearing age women between the ages of 18 and 35, and how important that is to birth outcomes and maternal health. I think you could easily, with the data, make that case, and a legislator would have to look at it and say, you're right. We need to look at how we design the policy to be counterproductive to people really being healthy and whole.
And I think that brings us to like the next kind of, oh, go ahead, Kendall.
I wanted to just piggyback on what Carolyn was saying, that also the mental health piece too, because we have been very successful with the Able To program. And I think I want to say about 60 to 70% of my participants have enrolled in Able To, and has helped them to make other decisions in their life, if it's with housing or taking care of their family. So that Able To program and the mental health piece is very important too for legislation.
Thank you, Kendall. And just for context, Able To is a virtual telehealth mental health therapy program that we've been able to connect into the pathway. So if somebody is enrolled and they have a pathway that they would like to receive that service and work in that, this is a resource. Unfortunately, it's a short-term resource, right? And so I think all of this, we are very grateful to our philanthropic funder, Quest for Health Equity, to allow us to be able to utilize the model here and contract with our CBO partners and elevate this work. But it all goes to that question of sustainability. And I think we talked about MCOs and we talked about other partners kind of supporting this work. So for the full panel, and we can start anywhere, but how can MCOs support this type of work that therefore supports community health workers and service providers in advancing programs such as this or the Pathways model? Maybe Sarah, you want to start?
Yeah, I can certainly start with Ohio's where the model developed, and it's had the longest run. And in our state now, we have 12 Pathways community hubs, so we cover about 90% of the state, and all of the Medicaid managed care organizations contract with those Pathways community hubs. So what we're building is really a population health approach where any woman who is on Medicaid, if she is at risk and needs care coordination, she's going to receive it. Whether she switches plans down the road or whatever, she's going to receive that continuous community-based care coordination to keep her in the best place she can be, or any at-risk population. But so really that's what we're trying to develop in other states too, is to really have managed care organizations see the value of coming in and supporting this network. And it's a win-win because half of your contract is tied to actually making sure something meaningful happens. So the way our contracting is designed is 50% tied to those measurable outcomes. So if the outcome isn't achieved, you're not paying for it. So I think it's really attractive in that way too for managed care organizations, but it's a way to work together collaboratively. There is no one organization or a healthcare system or health plan large enough to solve these issues. And so if we don't figure out a way to work together as a community, we're not going to hit the outcome. So managed care organizations are key partners in this, as well as philanthropy, private business, banks. There's all kinds of others that can help support this network.
Thank you, Fiorella. I feel like you need to jump in here and share on what your perspective is on that.
Yeah, I think, there's two kind of large ideas for this. So I think community engagement from MCOs, really identifying what their population needs through working with community stakeholders, learning more about their population, because data is data and it's great, but also getting more involved in the community will really drive your programs and the knowledge you need to design initiatives to really help your members. So I think that side, but then also, as Dr. Redding said, seeing the value in community-based organizations and their ability to drive change is important. And through reimbursement models such as the Pathways models or similar approaches, as long as they're value-based, it's really going to benefit the MCOs in the end, because we have the ability to reduce readmissions, reduce ED visits through these social changes, through these social interventions. So we are small, some of us are small, but we are mighty. And I think realizing the value that the community holds for MCOs is key to continued collaboration and success.
So is the vision here, let's say in our region, and how HCPC as an RHH, maybe you can unpack that as a regional health hub, how can we be a model to pilot all of these pieces together? Let's talk a little bit about what the vision is. What does that look like with MCOs partnering with who?
So I think, HCPC as an example is really integral to being a neutral entity. We have the ability to connect MCOs, Medicaid providers, and policymakers to the community. So kind of that intersection is really the place for us to be impactful through, I think, the blueprint really has to be outcome-driven, data-driven, and evidence-based, because we can show the changes that, based on the interventions we're doing, the changes that we're making to the community overall. So by partnering with these like HCPC or these really important pieces, backbone organizations in the community, MCOs, Medicaid, policy changes can happen because we can really connect them to what's happening on the ground.
Thank you. So we know, go ahead, Carolyn.
Yeah, I want to just chime in from a CBO, community-based organization standpoint. Programs like Pathways also helps to drive structure in terms of our service delivery, and again, increases the evidence-based approach to our work. And I think that's something that's really difficult sometimes for us as CBOs, having, we can't afford to pay, evaluators what they cost to come in and evaluate our programs and track our outcomes from a let's say from a data-driven standpoint. So having access to something like Pathways as a program is very, I think, helpful from a CBO perspective as it relates to having an evidence-based practice.
Excellent. And hopefully helps with workforce development. Go ahead, Dr. Redding.
Oh, I was just going to add, it's also really hard to contract with managed care organizations if you're a CBO that doesn't have experience in that space, that you almost have to hire a new person just to be able to go through security stuff and all of that. So it really helps to streamline all of that work through the Pathways Community Hub. And then you can have very small community-based organizations or very large community-based organizations, but everyone has a chance to access that funding.
Excellent. Go ahead.
I just wanted to add, I think, for Dr. Redding's point regarding having that neutral entity, and to Carolyn's point, because CBOs have limited resources, our smaller local CBOs, the hub or the community care hub or the hub in general can really provide that oversight for the program, can provide that contracting support, that data support, because these are larger resources that need to be implemented in order to be successful. So as a blueprint of what is our vision for the future, I think it's being able to provide that support for CBOs when they may have the limited resources and can't do that on their own, to create sustainability going forward. Because through that cost sharing of CBOs and hubs, CBOs can create that sustainability, can support their community health worker workforce, can support training and development. So I think there's a lot of great benefits when thinking of kind of outsourcing that contracting piece, but also driving increased different types of revenue to local organizations.
So I'm hearing, thank you. I'm hearing there's really two main kind of arms to how important this type of work, and the Pathways model in particular, is number one, it's an amazing way to help advance health equity for the folks that we're serving. And we see that there has been success in that. And we're young in this model, but I guarantee you we are going to have positive outcomes as we get to the evaluation phase and the work that's happened here. And then also the other arm is in regard to sustainability in community health worker workforce, as well as advancement, development, and sustainability of these types of programs within community. Anyone have anything to add to that? Am I missing, or am I hearing the right things? Looks like I'm hearing the right things. Great. Kendall, let's pull you into here. You have just such a unique perspective, and we love working with you. It's such a client-centric, at the end of the day, this is people helping people and having the right structure to be able to improve folks' lives, situations, addressing their needs. It starts with trust, obviously. So how do you initiate and then maintain those relationships as you're working with women, particularly in this model?
Well, I love it when the participants come in. I encourage them to come in because I like to do face-to-face, just so they can build trust amongst themselves with me. And I try to connect with them. I tell stories, they tell me their stories. And it's like when we were taking the Pathways training, no, maybe not, I'm getting confused, in the lactation. When you get to build up a trust with someone, they'll tell you their secret. And it's not a secret like, wow, I did this last night. It's a secret of like how they're living their lives, what it is that they want to improve upon. Sometimes they'll say things like, one mother came in and she said, well, my son is doing really well in school, and he's an A student. And so I start talking about another program that we have, like restorative justice. And then she'll tell me, well, he's an A student, but he's incarcerated. So it's like you build up that trust and then you take them to the next level. So now that I know that I'm helping her with Pathways, but we also have this program at New Destiny called Restorative Justice. So now I can put her into this program and also help her family get to the services that they need to help break down some of that generational stuff that's going on in the families and build a better future for themselves. So it's about building trust, and we all tend to do that along the way as we get to know each other better. So hope that answers your question.
It does. I know that, there is tremendous need and folks are dealing with major challenges. And I've heard anecdotally a few of the success stories from the work specifically with Pathways for Women. Is there anything that you're comfortable sharing as an example of somebody that you've been able to assist in what their needs were and the outcomes at this point?
Well, I had a young lady that came to me last year who was living in her car. She was homeless due to domestic violence, and she was also pregnant, and we helped her through the process of getting connected to a clinic with St. Joseph's, and she basically was able to pull herself up by the bootstraps. She found employment. Unfortunately, after the 5-month point, she did lose her baby. But the thing is that she had the support. She had New Destiny. She had Pathways. And so we were able to surround her with the care and love that she needed and to help her to deal with the process of losing her child. But she ended up inspiring us. Like, some people, when they have a death or something they're going through, you kind of feel bad for them. But in the meantime, because she had that support in the beginning from us, that she was able to inspire us, like in terms of a positive way. I had another mother, not a mother, but a young lady that's been coming to me for the past couple of months. And she also was in the process of losing her apartment. Just found a job through our support. She found a job full-time working as a security guard and was able to secure an apartment. So she's been in her apartment for 30 days, which was one of the requirements through Pathways. And also enrolled in the Able To program to help her deal with any anxiety that she was dealing with. I had another young lady. We have so many success stories. I had another a mother that came in last year, and she came in to get help with what is it, Carolyn? The program we had, the PSE&G. I think it was called the AHA.
Utility
And
reimbursement.
So while she was standing there, I noticed that she was in pain, and I said, "Are you okay?" And she said, "I'm leaking fluid." And I said, "Are you in labor?" And she was only like 4 months. And I said, "You need to forget about the PSE&G, get to the hospital right away." So there was another person there, Marissa, who was also a Pathways CHW. She translated everything to her in Spanish. And in Spanish. And it ended up that I told her that you need to go to the hospital and ask to have a cerclage. She didn't know anything about it. And a cerclage is when you have your cervix stitched to maintain the pregnancy. Well, it ended up she needed a cerclage. She came back 4 months later to thank us because we saved her life. We saved the baby. And now she's a permanent part of the program. I think she enrolled in Pathways, actually. She enrolled with Marissa 2 months ago. So it's a very valuable program, and I love it. And I look forward to many more success stories as we continue.
Thank you for sharing that, Kendall, and thank you for the work that you do. I think it's the hardest out of all of us here on this call. You are the one that helps really change people's lives, and so we're really honored to be a part of providing some tools and measures in this work. I'd like to ask, well, number one, if anybody's on the webinar that has any questions, please feel free to put them in the chat. We would love to be able to address those questions as we move forward in kind of wrapping up our discussion today. I think it's important. So hopefully we were able to share like high level and then what's happening here at the local level. But I'd like for the full panel to really think about and help share with the audience, how can the Pathways Community Hub model serve as a blueprint for other communities? Are there key insights that in our work with this, specifically with women, that can serve as a blueprint?
I want to hop in right away on that one. We also have a fatherhood initiative that we implemented here at our agency. Again, bringing that peer support, prevention, just helping men in general access social services. And what we learned is they have tremendous needs. But again, their needs are complex and they're all related in some aspect to social determinants of health. So I could absolutely see the vision for one day hiring a CHW who's implementing this Pathways model with fathers who need to get re-engaged with their children, but also address their own social determinants of health.
And I just want to hop in. So I think a lot of the outcomes that Kendall and Carolyn see on a day-to-day basis at their local CBO is because of a strong network of partners. So joining and you working together. So sometimes there is competition again amongst CBOs, but really that collaboration will drive more change. So through our work with the Pathways to Success for Women, we've seen that creating a strong network because of the limited resources in our community is vital, because if we can't get housing for somebody here in this agency, maybe their funding is run out. We're going to find housing for them through another funder. And then also to the policy change, MCOs and other state agencies have the opportunity to identify other needs besides clinical needs, for example, diapers, other types of prenatal and postnatal support through formula, through things like that for women, that we can help support and we can help disseminate into our communities, because those are the basic things that are needed for women to have better overall health and for their families to have better overall health.
So I was just going to step back to, I'm going to be in Austin in 2 weeks meeting with the medical directors of the plans there. And I was looking at, some of the state research that's been done in the past year, and they did a large focus group of plan members asking about non-medical drivers of health. The number one place people went was to their social support systems. They weren't going to the plans. They didn't feel like they were getting what they needed from the plans. They went to the people they knew and trusted in the community. So that's just really kind of supporting in other areas in the country too. What you're seeing, it's people need to go somewhere where they feel trust and they feel like they're being listened to and understood, and that you can actually help them and do something to make their lives better. And I would also add, so PCHI does a national learning network of all of our certified programs. So that's a great way that we can take learnings from what you're discovering and share with the rest of the country. And hopefully we'll get better faster that way.
Excellent. Thank you. I do see we have one question that was just posted. I'll read it verbatim and open it up to whoever would like to answer. It is how the conversation on access to Medicaid for undocumented immigrants in New Jersey can move forward based on data generated by the Pathways program. This community has a tremendous need to access healthcare, preventative health, and health literacy that ultimately will benefit all people from New Jersey. California became the first state to approve access to all eligible undocumented individuals to Medicaid. Fiorella, I'm going to start with you with Medicaid and New Jersey access.
So as a sanctuary city here in Patterson and Passaic, we're seeing a high influx of the immigrant population that need access to care. So that is a challenge for us when working with our members, because we know they don't have access to Medicaid. So ultimately, they go to other types of services such as self-pay organizations that have a sliding fee scale or charity care. But that does cause some strain on our current health system, because the enhanced number of people that are going to charity care is ultimately driving up the cost. So for us, I think gathering the information based on what Dr. Redding talked about before, the pathways we can close or the needs we can address for this population will be integral to provide that and talk to our policymakers, Medicaid, other MCOs, to show them, hey, this is still driving up the cost. Ultimately, we're all being affected in this way, and this is the data to prove it. How can we come up with a solution together to address and increase access to care for our immigrant population? But I do think it's something that's going to be more relevant in the coming months, in the coming years, because of the influx of the high number of immigrant population that we're seeing specifically in our local service areas. So, just collecting that data, being data driven, showing the value to our policymakers, I think can drive change. But it is going to be a challenge for us too, because we're dealing with it on a day-to-day basis.
Yeah. Thank you, Fiorella. I was going to say, that was the comment I was going to make after Dr. Redding's comments, is that one of the most difficult challenges is how to respond to the needs of our undocumented, community members. And one of the things that we are, we're appreciative of is that somehow they arrive fresh here in Patterson, and New Destiny is one of their first stops. So from that perspective, from a data collection standpoint, it's really important for us to keep a documented record of what their needs are and whether we were able to close that pathway. And if we were not able to close it, what's the incidence that's continuing to occur on an ongoing basis? That then becomes the input for the policymakers.
Thank you. Two things that came to mind for me in this question are, number one, New Jersey Cover All Kids initiative, which is now active and we are a partner in, which means anyone under the age of 19, regardless of immigration status, is eligible to apply for Medicaid. And so we are doing a lot of work with our community partners to elevate that. It's not the same as California, but I think it's definitely something that we need to elevate and make sure folks are connected to for care. And the other item here that I think of is in regard to the benefit when we do have generous funders, philanthropic organizations, because we are able to address the needs of folks who may be undocumented because of the openness of that funding. But with that going away, again, it can leave a gap. So it's really important for all of us to think about this. How do we create sustainable programs and policy change to advance health equity and address these needs? Sarah, anything to add there for the access for undocumented?
Yeah, no, I was just thinking the really mature Pathways community hubs have been around like 10, 15 years now. They have so many different funding streams, right? Because they'll use Medicaid. There's dabbling in Medicare now, but they have funding from United Way. They have funding from community benefits from hospitals. They just patchwork together to make sure that anybody they find can get services. And that's a really neat thing. I mean, once you, again, build this network, that's pretty unique. And so if you go after grant funding and you have data, it's more likely that you can get some support to add on those additional programs and coverage and services that you just can't get anywhere else.
Excellent. So we're coming up on about 4 minutes left for our time today. I think it will be important for us to leave here with closing thoughts, any calls to action, actionable next steps from everyone's perspective. So I open it up to whoever would like to start there. What are some closing thoughts? How should we move forward in creating sustainability here or actionable next steps from your perspective?
I would like to know if there are MCOs who'd like to come and kind of help us as we are innovating this new approach, and what value they may see in it. So one of the things that might be helpful is if we could put together a roundtable with MCOs to get their views on how they could see this benefiting their outcomes and whether or not they are open to partnering with us to fund, an expansion of the let's just say the capacity of this work. So that's one thing I could see coming out of it.
Thank you, Carolyn. Fiorella?
So I think a key kind of next step is for funders, MCOs, and even all the participants that have been hearing us today, is to really find out what's happening in their local community, to be able to create partnerships and collaboration with people that are already doing it, or kind of being innovative in a way to target those populations that they're interested in, that they want to help. So I think through partnership and collaboration, building a strong community network is what we should start to look at. So, reach out to your partners, reach out to other CBOs. What are they doing and how we can collaborate to create that strong community network, and then go to eventually lead to policy change.
Kendall, Sarah, we have about 1 minute left.
Well, I was thinking that just to continue the funding, the resources that we need to provide the education that is greatly needed to the community, so that they know that they have access to certain care, especially health care, that's going to help them be a healthier version of themselves at the end of the day.
Thank you.
And I'm just excited to see what you're going to build and be part of our national network as we kind of bring this model even higher up and hopefully get more sustainable funding for this work. So I think you're off to a great start.
Fantastic. Thank you so much. Joel did have as a representative, I think you all could see in the Q&A, very interested in partnering. So we will certainly take that as a takeaway, and thank you for your openness. I would just like to close by, number one, thanking all of you for your partnership, your time today, but most importantly, your role in developing the structure to really work together to advance health equity across the nation, and particularly in our region of service here. HCPC is moving forward with an application to become a certified Pathways Community Hub organization here in New Jersey. So we are working hard to make sure we are fully adhering to the model with partners like Carolyn and Kendall and some of our other CBO organizations. So I thank you, Fiorella, for all your leadership and your work in that effort. And I think there's some really great and exciting opportunity here for us to drive transformative change. So I know we got a little bit off specifically talking about advancing health equity for women, but the health of women drives the health of the entire community. And so thank you for starting there. And thanks to all of our partners and folks for joining us today.